Hi everyone, Professor Allen here. I'm going to give you a quick overview of what we're going to be doing this semester as we start our new class, Education Theory and Practice, RES 312. As you can see on the screen in front of you, this is the contact information. Please do not hesitate to please call me. You know how to use my cell phone number. Please text me. And for y'all, for the most part, we're going to be doing virtual type meetings if necessary. I do have some on-site office hours, and there are my start and end dates for the semester. You have an accelerated program, so you have 7.5-week semesters. That's based on those dates there, January 11th and May 3rd is based on a full 15 weeks. There are the office hours, but if you need me outside those hours, you know how to get a hold of me. For RES 312, this, as you can see there in the description, is just a review of the basic processes of education. We're going to talk about learning styles, developing objectives, teaching methods, questioning and problem-solving methods, the characteristics and roles of the clinical instructor, which is you, and how do you use those appropriately so that you can evaluate your students or your patients to see whether or not they're actually learning. For this course, you will not have a book. The book will be included in the course. We'll have handouts, links to watch, some videos, but you do not have a book to purchase for this course. You can go to the syllabi and you can review the syllabi. Pretty much the same thing. Here are the reading materials that we're going to be using, and there's some more going to be interjected and changed throughout the semester since we're making some changes to the course. The rest of this information is pretty standard. I do want to draw your attention to Wells Library. You do have access to the library, online resources there. These are the program learning outcomes. That's for you as a BSRT student. What should you learn from our program? And then you have your student learning outcomes. This is how we're teaching. The attendance policy is really important. You need to make sure that you're logging in and doing at least the discussion posts and getting your assignments in on time unless you have spoken with your professor. Your course evaluation, here is the way your grades are going to be calculated. You're going to have activity papers, not 1 through 7, but those papers are going to be 20% of your grade. You have quizzes, which are 15%. You'll have online discussions, which are 25%. Your final course project is 25%. And then your Teams meetings are 15%. Okay. I will tell you that this course, you have a project overview, and I'm going to actually read this. This course will require a summative project due during the final week of this course, just like the last semester. The intent is to build from each week towards a final course project. You'll utilize each week to build that finished project, and this summative project will employ the different learning objectives from each module. So I've highlighted that right here, and I want you, as you consider a topic for this particular semester, you're going to develop a theoretical connection to each of the objectives as it applies to your desired project. I want you to be thinking, remember back in RES 310, when you were thinking about a desired topic or for your capstone project, keep that in mind. Okay, if you need some help with that, please let me know. But you can continue to read where it talks about establishing your desired project, synopsis of the relevant learning styles, application in each in the clinical environment. I watched and saw many of your papers and the topics that you had chosen, and for the most part, you're going to be able to have an easy time applying the RES 312 course to your chosen topic. There are some of the textbook readings. You know that we're going to do Teams meetings, discussion, quizzes, and projects. Each week in here, for the most part, that should be appropriate. There might be some slight changes, but it will not affect you negatively. I believe you trust me on that. But you have all 7 weeks here as you walk through, and then you have your summative project. Go back to course and announcements and go back to reading. You know that each week I am going to post an announcement. I'm going to ask you to make sure that you go ahead and read that on Monday. It'll be posted by 3 o'clock. And you can see from Module 1, we're differentiating the various learning styles. And we're going to talk about those basic learning styles. There are the objectives for the week. Here are the clips, the learning style, either clips or websites. I want you to make sure that you are able to identify and open up. And as you can see, I'm opening up each one of these right now. There's your learning styles from Vanderbilt University. Then we have the learning styles, another learning styles talking about memletics. You have a couple of videos, adult learning, making sure it opens up for you so you can see. Here's this video here, Learning Styles YouTube. You're going to be able to watch that. It's 3 minutes and 16 seconds long. And this one here is 1 minute and 56 seconds long. So they're not long videos. So please make sure you take a look at that. You do have a discussion post, Learning Styles in the Clinical Setting. And you're going to evaluate and outline a learning style that has significance to a predetermined clinical challenge that you've experienced in the hospital. This is the rest of the instructions there. Remember, we post by Thursday night, 11:55 p.m., 200 words on the initial post. Make sure you include your reference, and then you can respond to 2 other students by Sunday evening, 11:55 p.m. Those posts I'm asking to be about 100 words. We will have our team meeting. We'll have one in week 1, week 3, and week 6. Week 1 will be Thursday, 3:10. Or whatever, that might be Wednesday, 3:10 at 8 p.m. We'll be talking about getting off to a good start and not getting behind in the course. We're going to provide an outline and demonstration of required navigation materials for Wolf Den and respiratory courses. This is going to be essential for the quiz for this week. So you need to be able to be at the Teams meeting. If you cannot, you need to go ahead and contact me. I'm doing it at a different time, 8 p.m. I'm going to keep it short and sweet, hopefully between a half hour, 45 minutes. We're going to discuss also the significance of the learning styles based on various patient populations. Look at your course project, capstone project, and I'll open it up to any kind of student questions. And then you see the disclaimer if you're unable to attend the Teams meeting. You have to write a summary and then submit it to me by email. Your Module 1 quiz is going to be on the Teams meeting and learning styles for a learning community. This is a little unique for you. So you need to make sure you review the video, because I'm going to have you navigating and answering some questions where you can find things in Wolf Den specific to a respiratory course and what I'm looking for you to do in our program. And then the learning style for a learning opportunity. This you need to do before the quiz. You're going to determine a learning style that you believe most satisfies a learning opportunity or a clinical activity in the clinical setting. You're going to define or describe the learning style. Say it's kinesthetic. You're going to have to define what kinesthetic is. Describe how it would be used. And then you're going to apply that learning style to this selected activity that you've chosen. Say you're going to teach a patient how to use an MDI. Then you're going to identify why you think the kinesthetic learning style would be the best appropriate learning style for that activity as an example. Then you're going to briefly again, identify the best course of action to facilitate the instruction and the outline of the implementation plan for that patient. So if you wanted to teach a patient how to use an MDI, you're going to outline the plan, describe the plan, talk about the things that you're going to have the patient do. And that will be already predetermined. You're going to have that in a Word document so that when you're taking the quiz and you come along the essay question in the quiz that says to do this, you're not looking at it for the first time. you're going to be able to draw from your knowledge. And then the 312 course project introduction. Remember that your capstone project, you chose your title last or topic last semester. You're going to be applying that all the way through the program. Look at that topic and look at each of the modules as we go through and see how you might be able to pull from each of those modules to add to your capstone project. And that's going to be your final summative paper. Hopefully this is helping you. Again, we're going to meet on 3/10 at 8 p.m. to discuss any questions that you have. But I do need you to go to coursework. It's really important because what I need you to do is I need you to complete the course online check-in acknowledgement. That needs to be done as soon as possible. You're going to click here. You're going to answer the questions. You have to answer all 4 to get the full credit, and make sure you have a valid cell phone number in there too. Once you've done that, then you have to do your student lounge post. Here you're going to post your post here, post your post. You're going to go ahead and put your post there. And then if you have any questions, this is the formal way the college is set up, that if you had questions, you can post them right here. Okay. When you go to coursework, you should see what's due next, and that's right there. So that needs to be done by 3/9. Hopefully that's helped you, and if you have any other questions, please let me know, and I look forward to seeing you in Wolf Den.